first things first, I want to thank you guys for showing up. I'm going to give what we call a 10-minute tactic, or just we're going to have a quick discussion about checklists in today's business world and how important those are. And it's not really just in dentistry, but it's everywhere. And I'll talk about that. I want to open up time for your questions. I can do live demos if you want. I'll just need to be directed. So as you're listening to this, maybe have SmileWizard open and be using it. That will probably prompt some questions that you may have, and we'll go and answer all those questions. I do want to talk about the SmileWizard promises, new functionality that has been released, which we'll talk about here in a minute, and I'll probably do a quick demo of it. I want to talk about the SmileWizard community and where you can go to get extra help. And I figured this would probably be small, so I wanted to hand out a $50 gift card at the end of this. And so I just kind of came up with that here at the end. So we'll get into this right away. The principles that I want to talk about really stem from this book by Atul Gawande. Atul Gawande is a surgeon in Boston. He's written a few books, and he has a very unique way of looking at checklists. And obviously, since he's in surgery, that's kind of where he formulated the idea of checklists. And it really didn't start with that necessarily. What it started with was he was interested in, and you'll look at the subtitle of the book, how to get things right. Because he noticed that in surgery, there was a lot of things happening, and he started to do a study about surgeries, and he realized over time that a lot of the issues that were happening were avoidable. And so put together a he put together a study, and they studied what types of issues were preventable and what was happening in surgery. And he was also brought into the World Health Organization at one point. And so the book kind of starts out and it talks about this study that he did and how he got involved in the in with this and the World Health Organization. But he talks about different industries that require these checklists. He gives several examples of aviation, medicine, construction, and finance. One of the things that I learned was that wouldn't you know that the top richest people in the world, a handful of them are hedge fund managers, and they actually use checklists in their day to day in order when they are evaluating new companies that they want to invest in, companies that they may want to buy. It's obvious that aviation is one of these. And I was on a flight from Dallas to Boise, Idaho, last summer. And imagine this, I walked up to the gate and I'm sitting there, and it looked like they were going to have a change of crew. And so I was sitting closer to the pilots, and one of the pilots leaned over to the other one. You could tell he was the more senior pilot. And he said, "Hey, do you mind if we skip the checklist? I really would like to turn this around very quickly so that we can get in the air. I need to get home for something very important." Now, when you hear this and you're sitting at the gate waiting to get on a plane, it's going to be a little bit, what are you going to do in that situation? Are you actually going to get on the flight? Are you going to trust your life basically to these pilots that are not going to be doing their checklist? So actually, that's a story that illustrates maybe in that situation how important these checklists really are. Another thing that he learned from this was as our knowledge and our capabilities grow, so does the complexity of our tasks. Our lives are complex anyway. We as dentists, I'm not a dentist, but I'm in this industry now. But the one thing that I can be sure of is that there are new things happening in dentistry all the time, and it amazes me. As those capabilities grow and as our knowledge grows, so does the complexity of our tasks that we have to do. We sort of insert things or into our day to day that we need to do. And a lot of times it gets very complex. When you sit down with a case, it gets complex very quickly. And you're trying to discover, you're trying to be the sleuth on what happens or how to treat this case. And some of them, you hear these stories about people who've been to dentists several times and they still don't know what the real underlying issues are. And the people who do go to the Dawson Academy, who do the mini residency, et cetera, that's one of the things that you'll really start. It uncovers your eyes, it opens your eyes to the possibilities in dentistry. And it hopefully what it does is gives you an appetite to take on more and more of these cases, no matter how complex they are. And that is definitely one way that you can grow your reputation in your area, in your locale, is by doing that. And to combat these issues, Atul Gawande says we should use these checklists to reduce the likelihood of errors and missteps. And so, that's obviously something that SmileWizard does to help. One of the things that he noticed in all these fields that he was talking about, everywhere where he studied that they use these, one day he was walking down, there was a new hospital being built right where he was at, and he went in and started talking to the foreman, and he couldn't believe the number of checklists that they actually had to build this building. And but they have to do that in order to reduce errors. They do it to be consistent and reliable. Checklists are a cognitive aid. A lot of people that use these checklists in their team, that actually improves team communication. It gives you empowerment and confidence, and they become very adaptable if you use them right. I would be willing to bet that there's a lot of people in their daily lives that don't realize it, but they're using checklists. One of the things in medicine that they talk about is, they've only been doing, you've heard of vital signs when somebody's in the hospital or in an intensive care unit, there's vital signs. These vital signs really came from not the doctors, but the nurses. And the nurses said, we need to have this checklist so that when we change shifts, when we come in and see a patient on our rounds, that we're able to see what their vitals were. The vitals is a checklist of things such as body temperature, such as medication, heartbeat, etc. But these checklists, now we think of them as, obviously they're going to have their vital signs. There's going to be a list and they're all going to be recorded there. But that didn't always used to be the case. And, you know, there were certain situations that Dr. Gawande talks about where because they started using these checklists in surgery, they started to reduce deaths. And at one point, in some parts of the world, they reduced death by up to 50%. And what a huge effort that was. I mean, and you would think it's such a simple thing, using these checklists, but it just makes the complex become a lot easier. There's one story where he has the checklist laying over the top of the scalpel so that before the surgery even starts, you can go through this checklist with the team before they begin. And there's several things that it eliminated. They did these studies, for example, at Johns Hopkins University, and they were probably one of the foremost teams. And you would think that Johns Hopkins is, they're all experts. You would consider them all experts. You would go in there and you would think, okay, I don't care who operates on me because this is one of the world's best hospitals. But it prevented several things after they did it for a while. And I would, venture to think that if you were to use these types of checklists in anything that you do, you would be able to be more efficient at doing these things, but especially as things get complicated and as they get complex. So interestingly, the book talks about different types of checklists. And there's a do confirm checklist. There's a read do checklist. The ones in the emergency rooms were a lot of times, or in the ICU or the OR, there were read do checklists. But there are also do confirm checklists and emergency checklists. Uh, and there's also routine checklists. I'm not going to go into that in super depth, but you hear the story of Sully Sullenberger, and when he took off, I think it was out of JFK Airport, he took off. A flock of birds flew into his engine, and they went out right away. The first thing that he did was he pulled a checklist off the shelf inside of the cockpit, and he was able to save all those people. In some industries, it's ingrained. And whenever you run into an emergency situation, there should be a checklist there that you can grab, that you can use, and it will definitely save lives. Um, One of the most interesting things to me about checklists are um, that you can adapt. One of the other slides said adaptability. Whenever we do complex tasks, whenever we rely on our own memory to do these things, we sort of fall into a trap. And a lot of times things can be easily missed, even though people are trained, they're professionals. And as you start to learn and these different techniques and they become more and more complex, you can change these checklists. You can adapt to these checklists. We think of SmileWizard as a big checklist. Even that checklist should be adaptable, in my opinion, um, to different ways of thought and to different schools of thought. The important thing is that you have a checklist and you're able to access that checklist and change it and adapt it to your own office. One of the things that we want to change in SmileWizard is the ability to do that. Right now, it's very rigid. It was designed with Pete Dawson's philosophy in mind. Back in the day when we first designed this, one of the things that they wanted to make sure of is you follow this checklist from step one to step two to step three to step four, and you're evaluating and doing this over time. What we've realized is that not a lot of people do that. Okay. And when you go into Smile Wizard and you're going through the steps, a lot of times you might want to change the order of it. For example, we have doctors who really pass a lot of this checklist stuff off to their office staff, and the office staff will go in, and because of that, they may start on tab two, then they may go to tab five, then they may go back to tab one, etc. So that's one of the things that we want to change about Smile Wizards, is we want to be able to put that in such a way that allows you to do in the order that you want to do with it. And the absence of a checklist is probably the worst thing you could do, especially as things get more and more complex. But I have a lot of doctors that have told me they'd like to do that. And so that's kind of where we're going. Um, and one of the most interesting things to me, another one of the most interesting things to me are that we tend to have a resistance to certain checklists. And a lot of, in the book, there's a lot of examples of people who, the hospital's in bad shape. They had to lay a bunch of people off. Uh, and they have this idea that they can reduce deaths in the hospital. They introduce these checklists, and there's a lot of resistance to it. A lot of people will say, you know what, I'm a professional. I do this. Um, Obviously, I'm going to do it right. I've got several years of training. But as you get started in something, for example, in a surgery or in an exam, for your patients, a lot of times something can happen. And a lot of times somebody can come to the door, somebody can distract you. And that's what I was actually happening in some of these surgeries. And it saved lives. It literally saved steps. It saved lives. So the reason we resist these things perhaps sometimes is it's the perception of simplicity, or maybe we have overconfidence, like I was just talking about. Sometimes there's implementation challenges, misunderstanding of the purpose of these checklists. And if you were going to start with, for example, doing complete dentistry, which the Dawson Academy teaches, and you use SmileWizard, how many of you integrate it into your flow, the flow of your practice? It's very important to do that. It's important for your staff to understand why we're doing this and why it will give us better results in the long run if we're repeatable and we do these things the same way over and over again. We become better and better at it. So you can educate, you can train, you can involve them in the design. You can say, hey, should we change this? Should we modify this, etc. Um, and you can have gradual implementation. Let's start small. Let's make sure that when we do this exam, we put these pictures in before we start or something. But it's that repetition. It's slowly getting to the rhythm of doing that. Um, when you do use checklists, and I now, so for dental procedures is obviously what SmileWizard is for, but if you take a step back and you say, okay, look at all the other ways that I can use a checklist and I can actually make my practice better. I can make the practice more repeatable. There are daily office checklists that could be used. There are customer satisfaction checklists. There's training and onboarding checklists that you can use with your staff. And it does bring a lot of accountability and responsibility. It can improve communication. And probably one of the most overlooked things that you can do is use um, these checklists to boost your practice value. When you, when, so I actually own a couple of different businesses and I belong to a group that evaluates the sale of a business. When you are going to sell your business, if you have inside of your business repeatable steps and these checklists that people can see, they can learn from. Um, for example, if you train office staff, your office staff you can use a checklist and you should use a checklist to sort of get them up and running. When you're talking to your customers, you should use them to go through the steps to make sure that the customers are satisfied, they get what they need, etc. And it actually boosts the value of your practice. When you sit down to evaluate, this is one of the things that they will probably look at and say, okay, you've got a great dental practice here, but what happens when the main person who is over the business leaves? Well, if heck's going to break loose and you got people that are not following the rules anymore, that's going to be a problem. And so the value of that business actually is going to go down. So I actually recommend, and in the dental world, this is probably a little different, but one of the things that's recommended to us as a small business owner is have an assistant, like a virtual assistant, and start to document all of the processes inside of your business. How do you do your social media? How do you do your customer support? Um, how is somebody, a new patient, onboarded into the practice? Hopefully, it is checklists that you can use that for. And that it just basically makes everything more efficient. And so, with that, I want to pause here for a second. And actually, let's go through these real quick. Um, these are the SmileWizard promises. Users of SmileWizard, this is what happens to them. But you have to do it. You have to be repeatable, right? Um, that it will build patient trust in your in what you bring to them, their treatment plans, etc. It boosts the confidence in your own dental work. You'll become it'll become easier and easier for you to see some of these things. And they say that when you use these checklists, again, back to the word adaptable, you should do every complex thing in your practice or everything that you know you're going to repeat. You should have a checklist, and you should onboard, etc., with a checklist. When you go through the exam for the first time, that's nothing more than a big checklist through the exam, through uploading the photos, through the 2D checklist, etc. You will reduce mistakes and redos because you're using the same practice, the same routine every time. Uh, and people who get to using it a lot, they will admit to you that it actually saves you time and money and reduces stress as well. And so, and you also do deeper dentistry. You get people into records and you go through the deep analysis of their mouth and where they're at and where they're headed, and you will have a bigger opportunity to understand what's going on, and you'll be able to kind of see a timeline, and you will be able to do more dentistry with the patients that you have as you do that. When we did this training a couple of months ago, we um, we had a section in there about how to get people into records, and we had one of the Dawson dentists here. I think it was Angie Headland. She has a very unique way of getting people onboarded, and you can view that training in the community. It also provides legal protection through documentation of what you're doing when you use it as well. So those are the promises that are had with that. And with that, I want to turn this
Hey,
into,
Travis, can you hear me?
yeah. Is that Charlie?
Yeah, how are you?
We're
Sorry to
good. How are
interrupt.
you?
Good.
Any, so I just got done talking about checklists and really kind of the book, uh, the Checklist Manifesto by Atul Gawande. Do you have any thoughts on using a checklist and being repeatable and implementing that into your practice?
Yeah, I mean that's what I love about the Smile Wizard is it just walks me straight through, it's just like our Dawson checklist and allows us to just be as efficient as we can and also make sure we check every box to know that we don't forget anything. So
One of the things I talked about was there's an apprehension when you talk to somebody about using a checklist. There's kind of a checklist. Do you find that it's easier? Does it actually save time?
100%. I mean, my assistant's, controlling the mouse and keyboard, and so as we talk, she'll type specific things. But it's kind of just a streamlined process that you have the flexibility. You can skip a page, you can go back to it if whatever workflow kind of works for you. And so there may be a time if we're all of a sudden talking about splints that we go to the airway segment and just kind of finish that little topic and then come back. And so I just feel, for me and just kind of my learning phase of through the Dawson Academy and just trying to be a better dentist, that having something to help guide me with the and be more efficient just makes sense. And so, I feel that the Wizard is such a great organizational skill set and it helps me stay on task, but also, if you're one of those people that is concerned about a checklist, it just allows you the flexibility. You can go forward or backwards, and you know, if you feel something isn't as important to you, you can always just skip that page. So I feel it's just such a benefit. We do it on everybody.
Awesome. Awesome. So, um, this is where we're about 30 minutes in as a time check. I wanted to see if there's anybody out there that has any questions about Smile Wizard. Um, if you can, I would just say unmute yourself. And I know that you have the opportunity maybe to raise your hand as well. Um, but is there anybody that's using it now that is maybe doesn't know how the interface works, um, or any? When we did this training before, we did it about a month ago, and we had some people respond, and one of their comments was, you know, we thought all the training was great, and you can go back and look at that in the community, but we thought all the training was great. But if you could allow us some time to maybe come on and ask our own questions and things, and maybe you could just show us, etc. Um, or if you just want to post it in the chat for those of you who are listening. And if we don't have anybody that wants to share or ask a question, I can show some things in the Smile Wizard as well. I will share my screen. Is that better?
Yes.
This is where I would, for example, this is the start screen. This is what you guys will come to. And when you're ready to go into somebody's case, you'll click on here and you'll go in and you'll start pre-screening. This is not going to be on yours either. This download exam data. Um, it might be on Charlie's, but we'll get into that. But there's some exciting things that are happening in Smile Wizard. We're actually putting an AI component into it, and so this is something, and it's just again to give you a preview of what's coming up. But if I say start pre-screen, again, this is the exam checklist, and you can go from tab 1 to tab 17 and put all your information in there. And what I was talking about is there's two links here. You can see in the bottom right hand corner it says Smile Wizard Community. If you click on that, that is a link that will allow you into the community, and there you can get more help. Um, so I'm just going to show you what it looks like. This is what you won't get this, but it says I can say return to community, and it brings me in here. And I can talk to people. If I go into this Smile Wizard help, uh, all of these are different sections that we're adding to the community. If I click on view, for example,
This is a tutorial of how to create a new patient.
so there's tutorials in there like this. A lot of people asking me about the 2D checklist, finding the ideal height and width. That video is inside of here as well. So if I were to click on there, I would be able to see that. Finding the ideal width is another one. And I believe this is the training that we did in August. And so you can go in there and watch that. But anybody with Smile Wizard can go in and get into these videos and use these videos. Let's see. So, but that's how you get into this community. And here we're trying to build it up over time so that we have more and more people joining. And but if you absolutely have any questions, please come in here um, and use it. It's probably needs to be more prominent, or one of the things is we're just trying to get the word out. I don't know, Dr. Wall, have you ever been in here to use this?
Um, Actually today I clicked on it, but I haven't. Sorry.
No, no worries. Really, just curious. Um, so with that, I'm going to go back into we'll go back into SmileWizard here. And if I go inside of a patient, for example, this is one of the patients I believe that is in the courses. I think it's in core 4 maybe. Um, Let me go back to this one. But I mean, just to give you kind of a quick tutorial on SmileWizard, once you enter those patients in, every patient will have an exam. Every patient will have photos. Every patient will have a 2D checklist, an imaging section, the 3D checklist, the treatment plan, and you can also export the data. So, any questions about that? Another thing that we're bringing into this is that up in this top right-hand section, there's going to be a space here for it's kind of like a tutorial so that when people get onboarded for the first time, they can go in and they can go step by step and it says, hey, you know, create your first patient. And so they create a patient, they go through the exam, etc. And it's something to just help people because it's not necessarily super intuitive to be able to do that. There's also some tools. Well, let me go back here. This little dot, these dots right here, if you open these up, you can join patients who have been to your office maybe twice. And a lot of these will be for example, if you're going to take these photos and you go through the complete exam, the patient may go through ortho, and which is going to change a lot of these things. If you need to join 2 visits together so that you have that patient's record in one location, you can join them right here. You can add another visit to this person right here. You can delete this patient or you can edit the patient's information. Not a lot of people know that necessarily. Um, and so one of the things that is new for everybody, and you probably have been through some of these 2D checklists and maybe not seen it, but for example, I'm going to click on this case and I'm going to go to this 2D checklist. And you'll notice that since I've already been here before, I'm not starting on tab 1. I'm starting on tab 2. However, if it's a new patient and they're just coming on board, you can click on you'll come to this right here. And according to Pete Dawson, Dr. Dawson, one of the things that he always preaches is that you need to have the TM joints stable and healthy before you can continue on. In the recent years, it's been, and this is again in your courses, if you've some of the instructors will say airway has now jumped to the top of that list. And so you have airway, is the airway acceptable? Yes or no? You'll be able to go in here now. If you click yes, then I can just continue. And there's nothing really that needs to be done. However, if the airway is not acceptable and it's out, for example, and they're seeing another doctor and they're going to come back to you later, you can say no and you can type in a reason why it's not. Maybe they're out getting a sleep study or something. But you can also click analyze and it will walk you through, has the patient been fitted with a provisional sleep appliance, yes or no? If the answer is no, then you might want to try that. If the answer is yes, then should the patient be referred to a doctor for a sleep test, yes or no? If they say yes, you can put in the doctor, is there a diagnosis yet, yes or no? If there's not, then continue normal treatment. And I can save and return, and I can go back and it will start me down that checklist. Or if they don't have healthy temporomandibular joints, they're not stable and healthy, you click no, and you can analyze this. And I'm just going to start over and show you this functionality. And it's as easy as this, behind the jaw. So where's the pain? With one finger point to where it hurts the most. You have the patient do this, and whatever they tell you, for example, if it's the cheek area, if it's the temporalis muscle, you just click on that, and it will then ask you, is there pain if pressure is applied under the cheekbone when opening your mouth? If you say yes, then it could be temporal tendonitis. If you say no, then it's possible myalgia of the temporalis muscle. And you can always go back and start this over. If it's behind the eye, is there pain if the pressure is applied to the back of the head? If they say yes, then it's possible occipital neuralgia. And so this will kind of give you ideas or insights into what they're experiencing and why. And if I save and return, it's obviously going to keep going because I have reasons in here now of, and it allows you to continue forward. It used to not allow you to do that, and you probably run into that, I would imagine. Um, so the 5 requirements of stable occlusion, nothing in here has changed, and you just go through those until you're ready to go on to the next step. So any questions about that? Any questions about that new functionality? We basically released it to everybody today. We've had several doctors look at it, and they've kind of said, yeah, we have a sort of a clinical advisory board. I'm not a dentist, but luckily we have guys like Dr. Wall that are, so they can help us out. So um, does anybody want to? What's your biggest struggle with SmileWizard? Is it just getting through? Does everybody think it's just it's a lot to take on? Um, One of the other questions that I get quite often is, oh wait, back in here in the 2D section, I'm getting a lot of feedback, and you can say yay or nay in the chat if this resonates with you. If you notice over here, when we're talking about the golden proportion ruler, the proportion or the ratio should be 1.6 to 1 to zero point 0.6. This example right here is actually a bad example. Would be curious if anybody could or understood why, especially when you look at the picture over here on the right. The difference perhaps is that the one over here on the right, if I look at this canine right here, and I'm using the golden proportion to go back and forth, and just as a quick side, you know, what you do is you line the picture up with the middle of, between the two centrals. You can stop it there. You can actually zoom in or zoom out if you want to. But once it's there, you want to lock that back down, and you want to put this blue line on the outside of one of the centrals, whichever central you think is the best one to use. Because what you're looking for that's the measured width of that tooth. And if I say, well, which one am I going to use as because obviously you want symmetry as best as you can. Well, I'm going to use this one on the left because the one on the right may or may not be okay. You save that there, and then basically that's kind of locked in place. And then you just use this to eye wherever you think the best location is. And the reason you do that is because you can use these other tools later on. But back to what I was getting to, if I save this and I go back into this, I'll close this. If I go back into this, you'll notice that this line of the 0.6 of that canine, isn't really in the right spot. Well, it's actually not. I'm going to change this picture because it's, this is the stuff that a lot of people don't realize yet. So you guys will understand this. Um, it's supposed to be, and I think it's called. Tell me if I'm wrong, Charlie. This is supposed to be the mesial third of that canine
Correct.
because of the way that it is turned. And so even though the ratio is correct, that picture on the left is not necessarily correct. And when you actually get in here to use this, don't feel bad if it's not exactly where you think it should be, because uh, this is actually this picture actually this real picture of a real patient is actually more correct than the other one. So don't get too hung up about that.
Yeah, I mean, I like to use it just as a reference point, as a guide. It allows you to kind of get a visual of like, hey, how far off am I? And ultimately, root size, tooth position, arch form, all those factors come into play. And so it just gets you in the ballpark to start thinking about golden proportions and where you can alter it to improve what we're trying to do.
100%. And just like, what he said about it's a guide, there are several things in here that are a guide. Even when you start talking about, if you're finding the ideal width, maybe the ideal width is 9.5, and that's where I'm landing with my golden proportion ruler. Again, it's just a guide. And then once I go to my central height and width, I have the golden, or I have the ideal width. Now I want the ideal height. And again, over here on the left, it's a guide. You can see as I move this up and down, the box on the right is actually moving, because what I want to do is I want to lengthen the tooth here. I want to lengthen it down here below, and I want to lengthen it up on top so that I can get my result closer to where it's supposed to be. Okay, maybe I'll drop this a little bit. Um, and maybe, for example, of this one, I'm just going to lengthen that. This is going to get you, their measure result is 75%. If you look in the bottom right, is the width to length ratio of the central incisor 75 to 85? Well, the answer now is yes. I'm not going to save this. Um, but you can also see, like if I make this larger, I can move these up and down. And basically what this is doing is it's measuring the distance between where I want it and where it is now. And because I can do that, and I can see those measurements here in the center, well, after I close it, I can say that the distance is zero point 0.1 millimeters on the top and 0.7 millimeters on the bottom. So naturally, what I would do is say, okay, this one on the top, I'm not going to touch it anymore because I know it's ideal, and I'm getting to 75% uh, width to length ratio, and that's where I want to be. And so I know I'm in the right position. And I will also say that again, this is a guide. It doesn't mean that I need to add zero point 0.1 millimeters, schedule that patient in and do like a laser um, gingivectomy or something like that. It's just a guide. Um, a lot of people will ask me about if the person has for example, a diastema or something like that. You basically would still center the photo, and if you're going to widen that teeth, you would still put the line in the middle. You would still, I wish I had an example of that, but you would still put it in the middle because you're probably going to widen that teeth, but not everybody wants that gap filled either. Um, I know several people who live with it, and it kind of becomes their part of their brand, I guess. David Letterman comes to mind, and Michael Strahan comes to mind. So, and I think Tom Cruise actually even used to have something like that, if I'm not mistaken. So, there's some tips and tricks. We talked about the airway, the new functionality. Um, if I go back to here, I know we're kind of getting short on time. We talked about the new functionality, the Airway and TMJ. It's alive for everybody now. Go ahead and play with it. Please send me your feedback. We talked about the community and the help. You can get more in there, more information in there. Um, and so I think what we're going to do, especially for newer users, we're going to start doing one of these we're going to start doing one of these every month, once a month, so people can come in and get some kind of a refresher. But seriously, if you just, please give me feedback on this and things that you want to include for next time. Once I get that feedback, I'll go in and make sure and adjust this. We want to make it friendly for everybody. Um, so please do that. And so another thing that I wanted to do was I wanted to do a giveaway since it's near Christmas, and I'm gonna do a giveaway real quick if I can. I've got a random number generator. Oh, there it is. This is called Online Dice. And I'm just going to go through. I'm only going to use one dice. It's going to be a six-sided dice. And I'm going to number everybody here in the chat. And I'm going to say, and you have to be live to get this. Uh, let's see. Dr. Sherry, you're going to be make you number 3. Dr. Jenkins, number 4. 3, 4, 5 is Dr. Revel, and Dr. Kendersetti, you'll be 6. So 4, let's see, 3, 4, 5, and 6. So I'm going to go ahead and roll it. And we'll even let Dr. Wall be number 1 in case he gets it. So 4.
Hey.
So Dr. Jenkins, you're going to win a $50 gift card just for showing up and for listening to this. So thank you very much. Any last remarks, Dr. Wall?
No, I mean, like I said, I just value, the whole checklist that we learn through the Dawson Academy, and this just allows me to really focus on signs of instability. That's our whole concept of the exam, is to, one, be thorough, but also to kind of come up with, concerns and help figure things out. And having it such in a straightforward process, and I love digital. That's my whole world. So back when we used to use the paper checklists, we're no longer scanning things in and everything. It's right there. It's easy to review, and no matter where you are, you can pull up the wizard. And so it just really helps to simplify a lot of the challenges that we have with cases, and turns them all into something that you can really start to process and help, treatment plan, which is our ultimate goal, is to figure out the dentistry that we need to do for our patients.
Yeah. Well, thanks for showing up. I understand that you've got people in your office today. You've got patients going on. So I really appreciate you showing up.
Yep, absolutely.
And
Glad to help.
we'll put this out there. Anything else from anybody else? All right. Well, thank you so much, and we'll be here in January to do another one of these. Hopefully, we'll clean it up a little bit and make it awesome.
Awesome. Thanks, Travis. Have a
Thank
good
you.
holiday, everybody.
All
Yep.
right.
See you.
Bye bye.